Nurse Allen coming to you today from Healing Healthcare Training Institute here in East Point, Michigan. Today I will be bringing to you how to pass your medication Aide successfully on your first attempt. First things first, you want to make sure that you're on time, 20 minutes, have your ID, be in uniform, and hair up in a bun. Now, once you guys did all of that, the proctor is going to take you into the clinical setting, and she's going to walk you through the classroom and all of your supplies. Now, once she's walked you through the supplies and gave you all said instructions, the next thing she's going to do is give you what your patient's names are that you're going to be giving medications to. After he or she does that, she's going to give you a start code to put into the computer. Now, don't start that start code until you're already prepared to start doing the MAR. Now, once you've opened up that MAR, it's going to look something like this in the background that I have up here. It's going to look exactly like that, and it's going to tell you what time you're going to give those medications. So once you find out what medications you're going to give at that time, you're going to start reading that MAR. That's your first check. You're going to do your 5 rights of medication administration. So that time you should be reading them off. All the medications you're going to give, you should know how to give that said medication. So whatever medications you have to give, you should be calling them off and then getting ready for your next check. You've done your first check. Now here's your second check. Your second check should be while you're pulling those medications to make sure against the MAR. So you should be pulling them out. But the first thing you're going to do is see if you have any parameters. So if you have any parameters to give with those medications, before you give those medications, you're going to make sure you don't have any parameters that you have to follow. Now, let's say you do have a parameter that you have to give with the medications. You and the proctor is going to do a check together for the apical pulse for that particular patient. You have to be within 4 with your proctor to be successful on this exam. Now that you were able to pull those medications because the parameters were okay, your third check should be comparing that MAR, those medications against the MAR again before you go to the patient's bedside. Before we gave any of those medications, the first thing we did was washed our hands and hand sanitized before we started. Now that we have all our medications, we should be gathering our supplies that we need. Any gloves, any water, all of those things before you even go to the patient's bedside. Make sure you have all those things with you so you don't have to be scrambling and running. Now at this time, you should be locking your cart and closing your MAR before you walk away from that cart, because you don't want her to take away any points because you walked away from your MAR and you didn't lock your cart. So make sure you have those keys with you prior to leaving that cart. You knock on the door, you greet the resident, you let the patient know what you're about to do. You're going to go through the 5 rights with the patient again to let them know what you're coming to do in your attempt. Once you're giving those medications, before you even give them, did you give her privacy? Depending on the medication that you're giving, you want to make sure that you give them a sip of water, assist them with taking their medications if they need to. If there's any kind of topical, you want to make sure that you're following any skin inspections. You want to make sure you did everything you did before you give that medication. Also, did we check the patient's ID band to make sure that's the right patient that we're giving medications to? You want to make sure as soon as you went in that room that you identified who that patient was, made sure you checked it against that MAR they're going to have on an armband to make sure that that patient is who you're supposed to give medications to. You got all your supplies. You're getting ready to administer those medications. You may have to put on gloves depending on what you're doing, if you're giving eye drops or a topical. Whatever it is, you want to make sure you're following the proper protocol prior to giving that medication. Now that you've given all said medications, the patient is okay, you've removed your gloves, you're now getting ready to return to your MAR. Now this is where it gets tricky because you want to make sure you follow all of the instructions that I give you. Right above me is the MAR. This is what the MAR is going to look like when you go to take that test, and you're going to document whatever date you're on to give that medication. Today is January 2nd, so you would be going on the 2nd for that time said given medication following the 5 rights. So you want to make sure you follow all the 5 rights when you come back to document those medications. If you had to give a pulse ox or anything like that, you want to make sure you document that as well. Last but not least, on the bottom, there's a section on the fourth one that you're going to make sure that you document your meds on that key legend that says meds given. It's always the fourth line. So when you're giving your medications, you're going to put your initials, then you're going to click and drag and make sure everything is in the right spots. You're going to make sure your initials are on all lines given of medications. Then you're going to make sure that you type your name all the way out and make sure you drag it and make sure it's on the correct line of all meds given. Now, once you've documented those medications, you want to go to the top. It's going to be a little bar on the top that says review. You're going to go up in the top right corner. It's going to give you a box that says review medications. You're going to go up to the review and it's going to show all of the documented meds that you've just documented. Once you've documented them and everything looks okay and on the correct line, then that's when you're going to go back up to the top where review is going to turn into a submit button. Now, before you hit that submit button, I highly recommend that you triple check that all your medications are in the proper boxes on the right line before you do so. Once you've checked your medication, you're going to hit the submit button, but let's say you made a mistake. You can always go to the mark where it says unmarked, and then you're going to take it and go fix whatever you need to go fix before you go to the next patient. Don't hit submit until you've already reviewed everything to make sure everything is correct. Now that everything's correct, you're confident that you've documented everything correctly, then you can hit the submit and go to the next one. Now, if you're done and this is your first one, you're going to the second one. It's going to be the same thing. You're going to go through the same scenario, document all your medications. After you've documented all your medication, you're going to go up to review, hit the review button. Once you reviewed everything and everything looks good, you hit the submit. You have 25 minutes, and I can't tell you how fast those 25 minutes go, so you want to make sure that you come prepared. These are in your test on TMU, so when you go on TMU, before you even go test, I highly recommend that you go and do the practice test so that you're successful and know how it works, because you may have practiced on POC or Epic or whatever system that your school or college did. They may not use the same system, and they do that to make sure that you understand that at each job you're going to go by the system that they have. So when you're going to test, keep an open mind that it's not going to be what were taught in school. You're there to test, and you're going to follow the instructions just as if you're getting a new job. Thank you and have a nice day. Please click like, subscribe, and share. I will be bringing you videos like this on a regular basis to help you be successful. I hope this was a help to you guys. If you have any questions, you can always reach out to us at hhtinstitute.com, and we will be glad to answer any questions. Thank you and have a nice day.